Hello, everybody. Welcome to another Zoom call. And just a reminder about where to find things. So you got to the Zoom call, I presume, through the member site. So last week there was a little confusion when somebody asked a question, and I said you'll find it on the home page of the member site. It's the main page of the member site. And I think they were looking for what they were looking for on our website. So there's a difference between Connors Clinic website that's available to the public and the member site that's available only to members. So the member site is that where you have to log in to get to the site. There's a number of pages, Zoom call page where you can see all the past Zoom calls and the login to this Zoom call that you're on. The home page of that member site is where you'll see announcements, what's new. You'll see other things on that home page that is pertinent to everybody immediately. Just differentiate between the member site when I say it's on the member site versus on the website. So that's the difference. Okay, easy thing to confuse sometimes. All right, let's jump right in. First question, you reviewed my last ultrasound down to 524 a month or so ago. We discussed the change in the main mass from 4.0 by 1.7 by 1.2 to 4.5 by 2.6 by 1.4. These were also done at a different facility by different technicians. Combined with labs and lack of other symptoms, you were very reassuring. Today, my functional doctor called, not a cancer doctor, she's out of her element, she admits, to report that she was told by the radiologist, apparently his big concern was the size of the mass of the axillary mass, which grew from 6 by 3 millimeters last year to 8 millimeters this year. And I don't know if you know what the other dimension was. So is this a lot for the lymph node, especially considered different machine, different tech? So if it grew to 8 by 3 or 8 by 5, so it grew 2 millimeters over the course of the year, is that a lot? No, that's not a lot. Um, so what a lot of growth would be like a doubling in size in 3 to 6 months. Still, if it doubled in size over 12 months, I'd still say that's cause for concern. When you're talking a couple millimeter difference, um, there's that much room for error on reading. So remember always that when you think of it, that your cancer isn't square, nor is it perfectly rectangular. It's not a rectangle growing in your armpit or in your breast or in your liver. It is a blob, and blobs have, think of a blob of of clay. Well, if you squashed it all over with your fingers and then you tried to take measurements. Well, how would you measure that? Well, depends on what angle you're looking at it, what angle you're holding that blob of clay. There's a lot of room for discrepancy. So when you're looking at changes in size, you're looking at changes that are relatively large. Also, even if it doubles in size, let's say, that would be a cause for concern. It wouldn't necessarily by itself be a cause for changing a course of care or changing a course of treatment in everybody's case. Why? Because you don't just look at one marker. So one marker would be one test, one lab, one CT scan, you look at other things. Why? Because other things can appear, can give you false impressions. It's the best way to put it. What do you mean by that? Well, okay, when you're measuring a mass with an ultrasound or a CT scan, or an MRI. The mass can appear larger by the way you measure it, by the dimensions that you're using as far as the angle that you're looking at it. There's so many variables that way. But the mass can also appear larger if the mass is dying. It might not be growth that's causing the enlargement. Maybe it's an immune flare around the cancer that is appearing larger. So I personally had patients that had a cancer mass enlarged, and then they go in to do surgery, and it wasn't the cancer that was enlarged, all the cells were dead. It was an immune response around it. That's a possibility too. But that is always the case. But these are the things that you have to consider. That's why you never just take one test and make your clinical decision. She would like, finish the question. She would like me to get another opinion, given all that I'm doing and my lack of progress. She mentioned other alternative doctors, blah, blah, blah. Absolutely, you can get another opinion for sure. But this phrase concerns me. All that I'm doing and my lack of progress. So this is where non-cancer doctors and lay people can make mistakes in thinking that you don't have progress because the cancer isn't shrinking. So that would, I think, what she is defining as progress. Why isn't the cancer shrinking? Okay, remember, cancer is cells that are in rapid replication. If it's no longer rapidly rapidly replicating, the rate of its increase in size is going to go down. Think the larger the cancer is, if the cells are all in rapid replication, it's going to get larger faster as time goes on. So if in the course of 1 year it's changed a couple millimeters, I would say that most of the cells are no longer cancerous. Why would you say lack of progress? To me, that's yeah, that's ignorance in understanding what cancer is. Am I discouraging you for getting another opinion? Absolutely not. Go get another opinion. Go get other tests if that would make you feel better. Do an MRI, do a PET scan, do other objective testing to give you some sense that you're staying on the right way. If you want to look at other clinics, then absolutely you should do that. I think, as a believer, you should be praying about your decisions, not making decisions based upon false security, but not making decisions based upon fear either. So look into those. This person asked another question a little bit later. I think it's this one. Just looked up Euromed Clinic. Their approach is something called the George Protocol after Dr. Frank George, which combines insulin potentiated chemotherapy, which is chemotherapy given with insulin so that the cancer cell would uptake the chemotherapy a little bit quicker and they could use 10% dosage with powerful homeopathic immune modulators specific to each patient's cancer. Well, that sounds delightful. I mean, that sounds like a great approach. So if a person wants to do chemotherapy but doesn't want to do high dose chemotherapy, then insulin potentiated chemotherapy is a different option and a good option. Anytime you're using a specific homeopathic, that's a even a better option as that. Um, but you got to weigh all it out. You're going to probably have to move down there for 3 months because typically the course of insulin potentiated chemotherapy is at least 3 to 6 months. So just got to weigh all it out. If that's the right thing for you, then by all means, look into that. What do you think about those vibration plate machines? Are they good for keeping the lymph system moving, to help with circulation, to move core strength by doing exercises on them, or any other real benefits to health? Excuse me, I had to take a drink there. The vibration plate machines are great. So typically those are called vibe plates. You're standing on this machine and it's vibrating. The benefit of it is multifold. From a lymphatic system standpoint, it's causing what's called muscular fasciculation, which is these teeny contractions of your muscles. So actually standing on a vibe plate for 5 minutes is like walking for 20 minutes or something like that. So it is a great way to contract your muscles, which thereby will help with lymph flow. And the simple vibration is going to help with lymph flow, help with your circulation, can build core strength, just like you said, especially if you're doing exercises on them. Also is a great stimulation for your cerebellum. Your cerebellum is the back part of the brain, which controls all your frontal motor cortex function goes through the cerebellum, and cerebellar issues can be very common. So the only thing that I'd say you be careful with them with is that you just go slow. Are there any contraindications to my machines? Yes, if you have um, like metal hip replacement or knee replacement. It could be too much vibration, could irritate that, could possibly dislocate that. You have to be careful with that. Biplate issues, if you have any brain issues, frontal cerebellar issues, you have to go really slow, maybe only a minute at a time on it. Even at that, you should start really slow anyhow, because it is a pretty strong cerebellar stimulation. So go real slow in starting. They can be great machines. They can be great for your brain. They can be great for all sorts of things. Concerning the metastasis of cancer to the lungs question from last week, I've tried the nebulized hydrogen peroxide as described by Mercola. Since I'm new to this, how long and how often should I do this? So your little nebulizer should only fill up about an ounce of fluid. You do that, it takes about 10 minutes, maybe 15 minutes to get through that nebulized hydrogen peroxide. And you could do this 3, 4 times a day if you want. I wouldn't do any longer than that. I wouldn't do any more than that. But certainly, yeah, you could do it 3 or 4 times a day. Space it out a couple hours between times that you're doing that. Um, I would say yes. Can you do nebulized iodine or nebulized baking soda for alkalization? I don't know. You'd have to look up a recipe for baking soda. That That's a possibility. I don't know a recipe for that. Um, Iodine, you could. I don't think iodine's going to be a direct killer for cancer that's in the lungs, though. So I would not do the iodine. I would stick to hydrogen peroxide. You could do colloidal silver, but that's typically more if you have an infection. You're talking about cancer. If you can find a recipe for baking soda, that would be fine, and hydrogen peroxide, and stick to those. My oncologist has me on Lupron for metastatic prostate cancer and now wants me to take Zytiga daily. So Zytiga is, if I remember correctly, that's a daily drug for testosterone energy deprivation therapy. I remember you had some reservations on Zytiga. It wasn't Zytiga that I had reservations on. I think when we were speaking, it was the bone drug. But in your opinion, what would be the long-term use of this product on my body? On the member site, back to the member site again. On the member site, there is a link to a search bar of drug from drugs.com where you can search the side effects of all medication. I would do that. Long-term effects of androgen deprivation therapy is, less and less testosterone, and the long-term effect is the inability to get your testosterone back post-treatment. And then if you're tolerating it well and you're not having any issues from it, then I'd say continue. If you're not tolerating it well, then you gotta think about, continuing with androgen deprivation therapy. Also, I have some concern in taking 3 500 milligram capsules of the B17 daily with meals. According to some literature, no one should take more than 10 apricot kernels per day, which averages about 200 milligrams. Well, that's interesting because all the literature for cancer is people are taking 20 to 50 apricot kernels per day. But the average apricot kernel is 20 milligrams and being exposed to so much cyanide, 1,500 milligrams of B17. Yeah, if you have issues with it, I mean, there are some people that are taking more than this and have no issues. There are some people that don't detoxify it well and they're getting some liver issues at this dosage. So if you have concerns about it, you could just start with one of those a day. That's just fine. B17 amygdalin is a is an oxidative therapy for cancer. It can be very beneficial, and you certainly don't take 1,500 milligrams for months and months and months. Usually, I have people on it for several months at a time, and then we drop off to a different therapy. But if you have concerns about it, by all means, you got to make that own decision yourself. I'm just giving you the information upon what came up on your testing. So there's a lot of people after we do cheek swab testing. Um, Funny is some people they have me do cheek swab testing. I do that for them, come up with a protocol, and they never end up buying the supplements. They never end up taking the supplements. They never follow through with anything I recommended. You don't know. I mean, that's okay. If you feel like God's leading you in a different direction, that's just fine. But there's lots of people that do pay for a whole program and then don't seem to do anything. There's people that we've gotten Rife machines back from family members of a patient that started with us, and we've never heard from them since they started, and they pass away. And a year or two later, we get the Rife machine back, and I have a way of looking at it, and I realize they never even used the thing. I don't know. I don't know why people make the decisions. I want you to be praying about your decisions. If you really feel like I think that's too much for me, then by all means start at a lower dosage. I want you to be responsible. I don't want you to, Dr. Connor said to do this, so I'm going to do it. I don't want to have that type of relationship with you. That's the type of relationship that the medical professional wants to have with you. They want you to do exactly what they tell you. They are somewhat next to God-like, and they want you to think that, and they want you to listen to everything they say. I'm just giving you my, um, you know, semi-educated opinion in everything. So I certainly don't know everything. And when I make recommendations upon your cheek swab test is just as what's tested on you that day that we got that cheek swab. So that can change over time too. And if you feel like God's leading you in a different direction as far as dosage or something else, you feel like you should add on. And I've said this hundreds of times on this Zoom call where people say, I really feel like I really feel led to take this too. What do you think? And I say, and I will do that. By all means, you need to be listening to God and having that relationship with Him that you can really feel like He's leading you. That's what I want from you most of all. I answered that question already. Any questions coming in on the chat? Otherwise, we're going to have a shorter Zoom call today. Okay, you guys are going to let my voice, my throat recover, huh? I have been losing 2 pounds per week. Okay, well, that's not good. 2 pounds per week, and you're eating everything you can. That's not good. We should have a phone conversation. So Um, we don't want so a person can be in weight loss with cancer because they made drastic changes in their diet and they're overweight when they start. And making those drastic changes and making lifestyle changes, you could go into a weight loss where you're losing a couple pounds a week because of those changes. If you're still above your normal weight or what you would your ideal weight, then I wouldn't be too concerned about that. or if it's coming from those dietary changes. If you're already at your ideal weight and you're still losing weight, then that's a concern. We need to address that. So, your schedule a time with me if that fits into your category. Okay, asked you about this last week, but you didn't recall receiving the question. The question was their Rife programming for this. Yeah, I thought I answered that question last week, and I thought I was gonna program a program for you, wasn't I? I think that's what I was supposed to do. Okay, so I think Angie's on the call. If you could remind me, let me just do a chat to myself. Um, Chronic fatigue syndrome program. Okay, so I will look that up. If I can't find that, I will create a program for you for that. Is a rebounder just as good as the vibration plate for lymphatics? Or you just have to do it for longer? For lymphatics, so the vibration plate, the benefit of the vibration plate is you get the muscle fasciculation just by standing on the plate. You're not doing any exercise. Now you can exercise on a vibe plate, and then you're getting the benefit of still the muscle fasciculation and the contraction of muscles depending on what exercises you're doing. So by far the vibe plate is more efficient. Um, what's better to move lymph? Well, that's a difficult question to answer. I'd still probably say the vibe plate. Um, Probably just because it's more efficient. So in the same amount of time that you're on the rebounder versus on the vibe plate, you're going to probably get a lot more muscle contraction on the vibe plate. 2.5 months on tamoxifen and 1.5 months on Lupron, having a hard time feeling the axillary lumps at all. Side effects are not that bad. Very grateful that things seem to be going well. So that's very good news. So you're going totally in the right direction. It's always very good news, especially when you're not having side effects from a medication. So most premenopausal women have severe side effects from tamoxifen. So it's what a blessing that you're not, probably everything else you're doing. You were supposed to get me some info. Okay, I will do that. Thank you so much. I sent myself a note. So if you don't hear anything by early next week, make sure you just call the office and remind Maureen to remind me to do that. All right. Any other questions? Referring to our phone consult Monday, the lymph in the report you said is a lymph behind the heart. What's kind of, well, yeah, the test was abdominal ultrasound. So it's actually behind, right above the diaphragm. You can actually Google that word and you can see, probably find a picture. If you look at images, you'll find a picture of where that lymph node area is. It's right above the diaphragm, right behind the inferior vena cava. Um, so you'll be able to see that. So it's near the heart. It's in an area that's difficult to get at, surgically. So Google did not understand well, just make sure you type it correctly, um, from that report. The crural lymph node area. So I know you'd be able to find it because it is an anatomical position. Crural, right here, crural region. Lists it right there. So I just Googled it and you can find it right there on Google. when you meet with me about my when ultrasound, I was asking you about recurrent rash. You said you would do some research on that. Um, yes, the recurrent rash that you were having, um, the the couple possibilities that I came up with was uh possible viral infections as one cause of recurrent rash. It's possible that so when you're exposed to something that stimulates an immune response, like a bug bite or a poison ivy, and you get these rashes, or something that stimulates a cytokine response, a very strong cytokine response, and the person gets a rash for a period of time. The other thing that I was looking at some literature is that it's possible that um, it's that there's a viral connection. So the problem with viruses is that some of them are possible to kill. Some theories are that they may not even be living organisms. So you can basically knock them down, but they can never go away. You can basically test every single person in the world for Epstein-Barr, and 90 some percent of the people will test positive for Epstein-Barr. Why do people, once you get a herpes virus that leads to cold sores, why do you get cold sores then throughout your life when you're exposed to lemon water or something like that? Because the virus lives in the ganglion of the nerve and it just comes out at opportunistic times. Well, sometimes those opportunistic times, well, for a virus might be a change in pH, like a herpes of the mouth, but some opportunistic times are when there's a huge cytokine response. So that's a possibility. You could try running the viral complex to see if that is it. There's also Epstein-Barr. There's other viruses, so we don't know if it's Epstein-Barr, but Epstein-Barr is very common. Um, Running that program. I think there's a psoriatic program. Oh, the one question I was going to ask with you with that rash, do you get any other symptoms with it, like joint pain? Um, because that could give us different clues to different issues too. So if there's any other symptoms that you get with it, then that can give you an idea what possibly it is. No, like fatigue or anything like that with it. Um, that would point more to Epstein-Barr. Then um, I would still maybe just run the instead, if that's not it, then I would run the viral complex. See if that helps knock it down. You could also run the parasite all kill frequency. The because that covers a wide range of different parasite frequencies. See if that is it. Those are the things that I would try if I were you. Is there anything I can do about the numbness around my axillary area from my mastectomy surgery last September, or is it too late? Been doing some dry brushing. Is there a Rife program? I also touch one area and I feel a weird zinging feeling than another. I figure it's just nerves. I would say most likely, yes, it's just nerves. And when they do surgery, it's going to kill off nerve endings. You got nerves that go to every cell of your body, and of course, they're going to do surgery. They're going to you're severing those nerves. So there's some things that even if you jumped on it right away, trying to do dry brushing, the nerve stimulation, anything, you'd still have the numbness. It doesn't make any difference. So that can go away over time because nerves do grow back at about, I think it's like a millimeter a month. So those can grow back and infiltrate that tissue. So, um, but there's not a lot more that you could do for it. I know vitamin B6 can help with nerve pain if it's a neuropathy type thing. You might want to consider taking some vitamin B6, but I don't know there's a whole lot you could do about that. run rife now when I don't have it, or when wait till I get it? Well, I mean, if you're symptom free right now, then maybe I wouldn't run it. I'd wait until you get it and see if that makes a difference. The other questions. All right. Well, we will sign off for the night then. Thanks for being on. No, I'll be praying for you guys and cherish your prayers for us and my throat as well. Thank you guys so much. Love you all. Bye bye now.